Yeah.
Massachusetts doesn't have any regulation when it comes to home care agencies. Once you're an LLC and once you've, signed up with the Secretary of State, that's about all you need. And so that is great in some respects because you don't have the regulatory oversight. But in the downside of that, or the yin and the yang to things, is that there's a lot of competition.
Hi, everybody, and welcome to another episode of the Elder Care Insights podcast by Welcome Back Home Care. And today we have Ryan McEniff, and he's from Boston, the Boston area. And Ryan, will you please introduce your company?
Yeah, absolutely. My name is Ryan McEniff. I'm the owner of Minute Women Home Care. We're a private home care agency located just outside of Boston in historic Lexington, Massachusetts, and um, uh, our focus is on Alzheimer's and dementia specialized care. And certainly we do general caregiving, but that's where our focus is right now.
Okay, so we'll just kind of let the cat out of the bag now and say we're both part of the mastermind group, which is a really great group where it's a national group where folks are throughout the nation. They own their home care CEO owners, or very much involved in operations, key employees. We all get together and we talk about some of our pain points and how we can learn from each other. And there's a lot of great information in these town halls and the one-on-ones. We're going to be in Atlanta, Georgia, around the 5th of May. And we're also in Dallas, Texas, which was a great experience not too long ago, I believe in October. So we want to kind of talk about what makes us different in the home care. I mentioned the mastermind group. I know that education is huge for us. You mentioned about a specific type of home care service that you're providing, a niche. You're niching down to the Alzheimer's dementia. What makes you different? And I kind of know why, because we have a little insider stuff, but I want to know specifically about your company right there in Lexington, historic Lexington. How do you niche down to this dementia specific type of care, and why does that make you better when people are in the area and their loved ones do have dementia and they need help?
Yeah, I mean, Massachusetts. I mean, this is where the mastermind's interesting, but there are certainly differences state to state in regulation. And
Yeah.
Massachusetts doesn't have any regulation when it comes to home care agencies. Once you're an LLC and once you've signed up with the Secretary of State, that's about all you need to do. And so that is great in some respects because you don't have the regulatory oversight. But in the downside of that, or the yin and the yang to things, is that there's a lot of competition, and the onus is on families to do their due diligence when hiring a private agency. While we have some of our cohorts in the mastermind that are from states where there's a mandatory minimum amount of training hours that have to be done every single year. And so the reason, to answer your question a bit more directly, the reason we decided to niche down in dementia and Alzheimer's care is because quite frankly, we were not doing as good of a job as a home care company as we thought we could be. Some of the challenges is that when you don't have any regulation, there's no incentive to further train your caregivers. There's no incentive to invest more than you have to into your company. And we were finding that a lot of our customers, as well as just in general families, were not getting the services they needed when their parents went into mid and late stage dementia. And a lot of those very difficult symptoms come out and start rearing their ugly heads, unfortunately, with this disease. And so our caregivers were unprepared, or families have been disappointed, not necessarily just with us, but in general with the level of service they've been finding from private agencies. So we said, hey, listen, why don't we try to elevate ourselves and provide the training that the caregivers are looking for to provide a service that's much needed in the greater Boston area?
Wow. Okay. So there's a lot to unpack in that answer.
Sure.
You have these. First of all, the big thing is, which in 2 minutes we learned a lot about Massachusetts, and that there's no regulation whatsoever with home care. I can go to Massachusetts, get a business license, start a corporation, and boom, Lee's Home Care is in business, and nobody's gonna check my files or come in on a survey and audit to make sure the background checks are good. Nobody does that whatsoever. That's the one thing, which is, like you said, it's there's a yin and a yang. Um, I really care about the service that we're providing, and that whole holding a. I can only imagine if we didn't have the accountability. Oh yeah, I trust these people. I just know they're good people. But then, when you actually do the check, and I'm sure y'all do your background checks and everything, that you find that they did something in the past, but you didn't have to run that background check. Is that what you're telling me? Like, there's zero type of do you have to run background checks on your caregivers, or is that like a marketing piece that you can say we actually run references and we actually run background checks?
Yeah, I mean, no, there's no regulation to do any of that type of stuff. Now, the majority of home care companies do background checks in Massachusetts. We have a state-run quarry that we can run, but there is no regulation on who we hire, what their credentials are. We can hire a neighbor to be a caregiver, and we're good to go in the eyes of the state. Now, obviously, the free market is going to have something to say about that. Where if you can keep sending out caregivers that are really not caregivers, then you're going to eventually have enough customers that are disappointed that they're going to go elsewhere. But as far as state oversight, no. I mean, and what I'm talking about strictly is private home care agencies. Obviously, if somebody's being reimbursed by Medicare or Medicaid under CMS, then they are regulated quite a bit.
Yeah.
But for
and that's
us,
a nice
we are not
segue.
regulated.
All right, that's a nice segue because we touched on this a little bit. I just saw your LinkedIn post about this CMS. You want to tell me a little bit about the 80-20 rule? You seem a bit passionate about this. How is this going to impact the industry? Because, I'm an advocate of the Home Care Association of America. I know they've been advocating. And can you tell me a little bit about this? I'm a little bit blind to this, so to speak. So my ears are wide open. I want to listen in and hear what you have to say about this 80-20 rule.
Yeah, I mean, the 80-20 rule and the devil's in the details. So I'm sure that there are exemptions and there are hardship exemptions in this. But, long story short, that, the CMS rule is saying that 80% of the reimbursements need to go to paying the direct care workers, which is whether it's nurses, whether it's CNAs, whether it's home health aides, and then 20% can be used for admin or profit. And so that has really a lot of agencies concerned, which it doesn't directly impact you, it doesn't directly impact me, but typically you're dealing with a much larger gross margin than 20%. Gross profit than 20%. So it is the concern from the HCAOA and other associations is that this is really going to squeeze agencies to the point that they may not be able to operate anymore. And then there could be indirect consequences because of that into the private home care segment.
Yeah. So let me just go on a tangent a little bit, right? Is the juice really worth the squeeze? Probably not. Not anymore, guys. So let's see what happens when government just decides to make rules for us. Let's see how that plays out in 2026. Let's see how many providers actually sign up for this thing. Because I've been skeptical since day one. Now I'm only going to make, I can only make a 20% at most. That's if I don't even pay the electric bill. So where are my margins really on this as a business owner? This is not a charitable endeavor, as much as we love people and love to help. But if I was in these organizations, which I'm not, I barely know much about them. They're Medicaid managed plans. I'm not part of Humana. I'm not part of these Simply Healthcare. I'm not part of United. It's just we looked into this very much because obviously we don't want to leave chips on the table. But we found that to stay in our small lane, our little niche, that has been good for us in South Florida, focusing primarily on private duty and knowing what we're good at right there. So if that's working for us and we're developing the relationships in that regard, now I'm just saying, hey, this thing has worked the whole way through. There's no way I'm jumping on board with these managed plans.
Yeah, it's going to be interesting. Now it's a 6-year rollout, so there is some runway there, and I'm sure what and I'm sure that what has passed and enacted today could possibly very well change over the course of a few years as the ramifications and the execution of this starts getting rolled out. But it's got a lot of people worried that they may have made the wrong choice in getting into certified home care services.
Yeah.
And where that can have downstream effects for private agencies is that could that there are a couple areas. Could that cause the rates for these rate increases for certified caregivers may mean that private agencies have to increase their rates to continue recruiting their caregivers, which then will continue to increase the costs that are passed along to families. It could mean that people leave the industry as a whole, and there's more caregivers to go around for private agencies, or maybe even more likely, especially in Massachusetts, it may cause these agencies to discontinue that line of services and transition into private pay, which would be more competition, more agencies in an already kind of crowded industry, which means that there's even more choice to go around. So there certainly are indirect consequences of this, but time will tell, and we'll see if it ends up being a real problem. And the only thing I'll add to it is that I know in Massachusetts, a lot of agency owners, including myself, were worried about the minimum wage going up to $15 an hour. And that was a big deal, right? This is going to cause major waves, blah, 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 blah. And even before it hit $15 an hour, because it went up in 75-cent increments over the course of a number of years, by the time it hit $15 an hour, we were way past $15 an hour starting wages for caregivers. Inflation and the cost of living had just risen so much that you weren't even going to hire a caregiver at $15 an hour. Nobody was going to apply to your job at that rate. So I do look at it the other side, that there could be a lot of cause for concern, but this could be also overblown where, by the time this rule gets fully enacted 6 years from now, the landscape may have changed and it may be inconsequential. I don't know, but I try to take some of my previous experiences where government comes in and says, hey, you have to do things a certain way, and you get worried about it, and then it ends up not really affecting you in the way that you thought it did. So time will tell.
Yeah, things always seem a lot worse, when they're coming at you that day. And if you could fast forward a year later, 5 years later, you'd say, "Oh, why did I get all worked up over this?" It
Exactly.
really wasn't that big of an intervention. I could get worked up over. I could say the road to hell is paved with good intentions. And that's what the U.S. government's trying to do. It seems like, oh, let's pay these people. So I get that it's very well intended. But it's not something that I think I think the lobbyists are going to be out in full force. They're going to kind of, because there is a lot of money that goes to these managed care plans. There's a lot of government money, and I think that there's going to be a fight on both sides to say, there's some business models that have the managed care plans. They could be 80-20 with their managed care plans. Like, they've developed this great system where they're getting all the referrals from these managed care plans. Somehow they make it with the margins, and now their business is highly affected. So, but like you said, time certainly will tell. Now, we spoke about the dementia certification. How did you can call yourself anything you want, but the proof is in the pudding. So, what is it that you really do to make your folks dementia specialists?
Yeah, it's a fair question, right? I mean, what we've done is over the course of the last year, and it's still being rolled out, so we're not 100% of the way there yet. But we've rolled out online training programs for our caregivers to be certified in the fundamentals of Alzheimer's. And then there are further trainings that allow them to get much more comfortable with the different symptoms that occur when somebody has mid to late stage dementia. So if we're sending a caregiver into a client's home that has certain triggers, we want them to be prepared to handle those triggers when they come up, so that they are addressing our clients with the best possible way. Additionally, it also starts out at the assessment. We have a much more in-depth assessment that we do with our clients that focuses on dementia, and again those triggers. And to use an example, we had a potential client that let us know that the trigger for their loved one with living with dementia was that they really had some issues when somebody was sedentary, meaning that if a caregiver was sitting down, or anybody was sitting down for a long period of time, that would really cause some stress to the client, and then that would trigger some frustrations, and it would get them worked up. And we actually ended up declining that client because, as you know, a lot of the times caregivers are sitting there waiting for their services to be needed, right? We are the safety net for a lot of these clients. So if a client is sitting there watching the Red Sox game and the house is clean and the meals have been made and the dishes have been put away, the caregiver is going to be sitting there waiting for our client to need a snack or want to go to the bathroom or get ready for bed. And if that's going to trigger that prospective client that they're going to have a lower quality of life because that's going on, then that doesn't really make sense. And that was an example in which we weren't the right fit for our clients, and we declined that client and advised them on alternative solutions so that they would be able to have their loved one have a better quality of life with the chronic disease that they had with dementia. And so that's kind of where we're trying to go, and we are on the process of going down that road.
Yeah.
So that's kind of what we've done. And then we've also done in-person trainings where we have a group of caregivers come in and go through our person-centered Alzheimer's training, so that there is a kind of like the mastermind, there is a group think there where somebody has some experiences and they can let others know about what's been successful for them and what hasn't been successful for them.
Yeah, that's so amazing to bring caregivers the tools and the knowledge that they can take with them wherever they go. They hopefully they stay with you, but they seriously are able now to help maybe a family member, maybe give education to others. And I think the world, really needs that and needs to help provide knowledge, education, through our experiences. And that is very admirable. And I would say that's why I refer, to Ryan's company when people are moving. And I've dropped your name a couple times. I just don't think it's translated. But, that's also a great thing in the mastermind group that we're learning from, which will bring me to my next topic, which is kind of a same topic, which is this dementia care training and the Tinder Rose town hall, which was inspiring, I think, to all of us. And he had some very, very key insights, very sharp person, Jim Kimsey. And he basically knew that he had a serious value in California because he was the pioneer of this specialized training. As far as I know, he's the pioneer. And he was able to raise the cost of care because these cases were so difficult, like the sedimentary case, or a case where someone's combative or sundowning. And he was just able to somehow make it work. Of course, it's California, so like price is no issue there. But he realized that if he charged a very high premium, that he can make any case work essentially. What are your thoughts on that? And are you trying to follow his model? And also, one more question: are you incorporating any sort of like All's Better app or All's Care app to help bring technology to these things, so you don't have to do the training yourself? They'll just get reminders.
Yeah, so a couple questions there. I mean, Jim Kenzie was definitely a catalyst to move forward with specialized dementia care. We were looking at specializing in something, and we were looking at a couple different options. And after we saw him speak, what made us think, hey, listen, if this guy was so successful with this, then maybe we should do that. I think originally I didn't want to go down the dementia road because a lot of companies say that they do dementia, and they really don't. They do what Jim calls dementia light, where they have a web page that has a few paragraphs about it, and they can help with the little old lady that repeats themselves quite a bit. But then once those, as you said, those complicated symptoms and difficulties occur, then it quickly becomes out of their depth. And so his town hall was really helpful in making that decision and crafting a plan on how to roll this out. I would say though, just to push back a little bit on California, I think he's having the same issues that I'm going to have, which is not everybody can afford an elevated cost of private care. If his competitors were charging 10 or 20% less than what he was charging, that is competition that can be a problem. But not everybody in California, nor everybody in Boston, which is another wealthy area in this country, can afford ongoing private home care services. And so the model that we have, as well as Jim had, was that the minimum of about at least 3 days consecutively of 8 hours a day, but ideally 40 hours a week of care, for a lot of families is all very expensive, and it may put our services out of reach. So what we have to do as a company is provide such value that it is worth the cost of our services. And so that is where we did hire the All's Better app. And Gary, who owns All's Better, is also part of the mastermind group and is a home care, dementia specialized home care company. We did purchase his online training apps, and we've found a lot of success and good feedback from caregivers that use All's Better. And I'm sure down the road we will look at other options like Keep Snow or whatever other options come up. I mean, there are some great trainers out there. But for this point in time, we had heard a lot of great things about All's Better from folks outside of the mastermind group that didn't really have a dog in the fight, and so we decided to move forward with them. And thus far, it's been really good, and I would recommend it.
Very good. So yeah, that's interesting. I'm sure you did. Like you had mentioned, you're not sure exactly. You wanted to pull the trigger on dementia, down that dementia road. Were there's other ailments and things you were thinking of? I know that in the 10 years in business, I've seen a lot of things, but it's mainly like a handful of the same things. What were you thinking of aside from dementia specialty?
We were really looking at stroke care. We had considered kind of a mix of stroke, maybe heart, COPD. But we ended up going with dementia because it's a disease that takes a long time to develop, as well as succumb to. And you have families that really want their loved ones to stay in their home. Consistency of caregivers is really key for that. So if somebody's saying, listen, we want to keep mom home, and because of Alzheimer's or dementia, they really need consistency of caregivers, that allows us to be more attractive to caregivers that we want to hire, to try to provide them opportunities where they're going to one case ongoing for a long period of time. So it kind of matched up, because what we're seeing, at least in the Boston area, is that caregivers are really unhappy with short hour shifts, and they're unhappy with short cases that last a few weeks or maybe a month at the most. And then they're unemployed, and then they're scrounging, looking for work somewhere else with another agency. Just like anybody, they want to have consistency of their day. They want to have consistency of a paycheck. And we felt like we were going to be able to match really great caregivers with long-term clients to make it a win-win for both the family, both our employees, and for the business.
Amazing, amazing. So I think now's a perfect time just to give a plug, for your website, give a phone number, because we're not doing this thing just for South Florida. This is a national movement. We're just trying to educate. So please go ahead, Ryan. I think that'd be a good idea.
Yeah. So, I mean, if you type in Minute Women to Google, you'll be able to find our website. So just type in Minute Women Home Care, and that will bring us up. And our phone number is 781-862-3300. We also have a podcast that Lee's been nice enough to be a guest on as well, called The Caregivers Toolbox. And the focus on that podcast isn't a money-making endeavor. It's to provide a way to provide education to families and people that are looking to learn more about senior care. As I'm sure Lee can attest to, a lot of the times when we get clients, it's in an emergency situation. They haven't even thought about, let alone know about what home care is and the different types of home care. And they're trying to drink from the fire hose and learn this all at one time. And, one of our core values is education. So we wanted to provide free resources out there for people to better inform themselves. And if home care is the right fit for you, great. If there's an alternative service that would be a better match for your loved one, that's good as well, because at the end of the day, we want what's best for our families and our parents.
Yeah. So, how long? And I know this is I'm impressed by this. You may be the longest tenured home care company in the Boston area. Like, how long has the Minute Women home care been in existence for?
Yeah, my aunt started the company. It's a family-run company, and she started in 1969. So we're one of, if not the oldest, home care company in the greater Boston or Massachusetts area. Why we're not bigger is a question people ask, and basically, my aunt kind of unofficially retired in late 90s, 2000s time frame, and kind of let the company run on its own kind of momentum. And that is really kind of that time frame where assisted livings and other home care agencies really exploded. And it's great of what we've done, but in that kind of 10-year, 13-year gap between when she kind of just let it run on its own versus when I kind of took over and started reinvesting into the company, the landscape had changed quite dramatically, and there were a lot more services out there. And it's kind of funny, I only bring that up is because I interviewed Andrea Cohen, who started Houseworks, which is a really big company. They actually graduated from Home Care CEO because it became so big that they were competing with too many other agencies. And we were having a laugh about that because at the time, Minute Women also did childcare, and we don't do that anymore. But she had used us for childcare services for her own kids when she was starting and developing Houseworks, which was 2 towns over from where we're at. So it kind of just goes to show you that there are a lot of great agencies out there, certainly in the Massachusetts area, but the families really need to do their due diligence and picking the one that they feel is they're most comfortable with and is best for the best ones for their loved one.
Yeah. Not to go off on too far, but is the childcare a regulated industry, or is it similar to the elderly type of care?
Honestly, I don't really know anymore because I never did the childcare. That had closed down by the time I had taken over. At the time, we were doing house cleaning as well as elder care. And over time, house cleaning really didn't make sense anymore. We wanted to specialize in one thing, which was home care, and do it really well. And so I imagine it's much more regulated, but I can't speak to that specifically.
Yeah, I've had that same type of idea. I think this is like your aunt must be an entrepreneur. It seems like she's got a lot of things going on. God bless her. I thought about some things myself. Why not get into this cleaning business? We're already in the homes. They're always asking us for these referrals anyway. But looking back in the rearview mirror, I'm quite happy that I never decided to launch the Welcome Back, cleaning business. Because you're right. I think it's important to just focus on the one thing. And a famous quote from Gary Keller that is famous in my own mind, at least, is be like the stamp, stick to one thing until you get there. Right. So when is it? When is it? And so I guess that's the thing is, I know I'm pretty sure you may even have your 10-year business plan that's probably close to the chest. You keep close to the vest, or 5-year business plan. So when we have these types of vision and goal setting strategies with the help of Jensen, with the help of people like Stephen Tweed, this gives us much more of a feasibility to achieve those goals because we have people like that in our orbit who are big advocates on core values, on your mission, on your purpose, and your culture. So it's like a living, breathing document that we need to continuously, run on. And so to circle back to the entrepreneurship, thinking about opening these different companies, there's different ideas out there because we have a pretty big platform, you have a big platform, and so staying focused, just private duty home care, and also niching down, you're niching down to the dementia care. I think that's really the right way to go. Although I am very, very tempted to open up side stream revenue providers, and we've talked about it. I'm not like keeping it to myself. I do a lot of care management. My company does a lot of good listening to people and making sure we give good recommendations to our best, the best we can do. But we're not advisors. We don't charge for this. When it comes down to it, I refer out to care management, and sometimes it works perfectly because it's not in my wheelhouse particularly. I'm not an expert at it. But there's these things that always come to us, these possible referrals, or, we could take that on ourselves, whether it's placement. I know that that's been discussed in the mastermind. It's complementary a lot of times. How do you stay so focused?
Yeah, well, I mean, kind of two thoughts that came into my mind. I'll go with the last one first. There are pros and cons to opening up other service lines, right? So we have an agency in the greater Boston area. They may be national, I don't know. They're called All Care, and so they do hospice, VNA, and private duty. And so that's great. They can do all three parts of the in-home care process. Now, the downside of that is they probably don't get a whole lot of referrals from their counterparts in the industry, right? So I'm more than happy to partner with a VNA or a certified home care agency because I don't do certified. And then when they have somebody that's appropriate for private care, they can make that referral back to me. And that's where you can have a referral relationship with somebody. Now, when you open up other lines of business, certainly that can bring in revenue, and that's certainly a good thing, right? That's what we're all here to do, is to grow our businesses. But the downside of that is you're probably not going to have as many referral partners that are out in the community as you may otherwise have if you just did one thing really well. So there's those pros and cons to it. And so for All Care, that works for them and good for them. And for other agencies, they've decided to go in a different direction. As far as being focused, I think, there's two things that's happened over the last 2 years with Men and Women has been working with Home Care CEO and working with Jensen. I think their model of business really makes a lot of sense. I've worked with other coaches in the past, and while I think they've been good, I think the benefit and the ability to be humble in Jensen's part of saying, I don't know everything in the world, and bringing together a group of people that aren't competing with each other, that can have collective knowledge that far exceeds what Jensen or a single individual can know, so that I've had this experience and then somebody else in the group is saying, hey, listen, I need guidance on this. Jensen hasn't experienced everything in the world. He can only give you the best practices, but if somebody has had that experience and knows exactly what you're going through, then that information and that help is going to be really valuable. And I think the way that they've done that with the mastermind group has really been great in my eyes. And that's where I find the value. Not that Jensen isn't great, but the collective group is really where a huge amount of value comes from. And then as far as the other thing, to answer your second question of focus and vision, is that typically the owners of companies kind of have the ADD mentality where they see something shiny and they want to go after that. And then next week it's this new project and, oh my God, here's a really cool idea. How about we go look into this, which can cause a lot of issues downstream with your day-to-day admin staff. And so we, through a lot of hearing good things about it, implemented the EOS system, which is the entrepreneur operating system. I had read a lot of self-help books from people like
Gino Wickman.
Mm-hmm. Yeah, Gino Wickman. I've read a lot of self-help books and business books from folks. Some of them have been great, and some of them I'm shocked that they were bestsellers because I thought they were total crap. And
yeah, I like the self-improvement. I like self-improvement.
Certainly. And I think that there's a lot of self-improvement books out there that could be summarized in a blog post and not a 300-page book.
Yeah,
and what I liked about the EOS system was that, whether it was in a podcast or maybe it was the first couple pages of the book, they said this is not a magical elixir that's going to make your business amazing. This is some processes that, if implemented correctly over time, is going to help your chances of your business succeeding. And I think, knowing now that I am that kind of ADD visionary type owner, that I can see where I want to go, but I don't necessarily have the ability to plan out how to get there. EOS has really been helpful in putting structure into a business that maybe needed some structure, so that we can all be rowing in the same direction and get to the destination. So, that is what we've used over the course of time, is the EOS system and the software 90.io to have a cloud-based solution so that our team can get together once a week, do our meetings, know what the issues are, solve issues, and all be on the same page so that we are getting and striving to the same goal.
So you're using a software technology to meet together to do your level 10 meetings?
Yeah, so 90IO seems to be a popular one. I think there are a couple others out there, but it's basically the EOS system online, so that people obviously have their user profiles and they can put their VTO information in, they can put their issues in, you can have your scorecard there, you can put your rocks in there. And then that way, in a world where a lot of people are remote or not everybody's in the same room at the same time, you can all get together and be able to track how everybody's doing.
Yeah, that's sweet. Okay, we'll talk more offline about that. And, for everybody, listen, this also came from Jim Kimsey. Or did you know about EOS before Jim, or was it the town hall that? Because that's how I learned about it.
I mean,
but I heard about it.
I had heard about EOS before, and I was skeptical of it because of what I said before, is that I had heard about all these things that are supposed to make your business so amazing, right? And certainly Jim's town hall made me much more interested in it. And then I actually talked to some people in the mastermind group, not about EOS, just about business. And then they said, yeah, we run on EOS. We really like it. We really like this. And as I started to investigate it more and more, it really made a lot of sense that it can work not only for home care, but it can really work for any business. And if I were to start a new venture in a new industry, I would bring EOS along with me.
100%. And these are great reminders for myself, and great ideas for the audience. You don't have to be a home care person, to kind of pick up on these great ideas. I think years down the road, people are going to look back at these podcasts and they're just going to watch them vigorously, like, oh my gosh, how much information is in on these things. Like, this can be inspiring for people if they're not sure which way to go, or they're in the business and they're just kind of stuck in and feel like they're in quicksand. Pick up this book. Just Google EOS, Entrepreneur Operating System, and it's had a serious momentum swing on my company, my organization. We've grown year over year because of ideas like this, because of rocks. Rocks are like the 90-day goals you want to achieve. It's just, you put a word to a goal, and you don't have to go 100%. You don't have to achieve all your goals, but you want to go for 80%. You want to get there, and have this stuff written down so we don't have the crazy entrepreneurial mindset where it's like, we don't always write to-do lists and things like that. These things are kind of helpful. You have a to-do list. You have, where you left off. And I think that's good to have that software. You basically don't have to have a note taker. Does it record the meetings, or does it kind of, you just input the data and it will follow up?
Yeah, so you need to put your information in. So issues that you're having. So what Lee's talking about is with EOS, you have a weekly level 10 meeting. And that level 10 meeting is meant to eliminate all other meetings throughout the week with your team. So everything is dealt with in that one meeting. So you go through your scorecard, your KPIs, you go through your rocks. Your rocks are your big projects that are going to move the company forward, that are going to take about a quarter to complete. You go through your to-dos, your weekly to-dos of what needs to get done to be able to complete those rocks. And then you go through the IDS, which is your issues list and solving issues. And so it allows the team to be able to put down any issue that they have, and collectively as a group, you can try to solve that issue. And like anything, leaders should eat last. So the owner of the company should be the one that is the least talkative or the most quiet in that meeting, and only interject when maybe it's going down the wrong road, or maybe there's some law that they're going to violate that they don't know about with HR policy that they say, well, why can't we just do this? Well, hold on. And so it allows that to happen. So there's some inputting of the information in, but it allows there to be a written record, if you will, online of where you're going. So it's not on paper and you don't have to do it on an Excel sheet. And then you can take it from there. And then in the US system, you can hire what's called an implementer, which is a way of saying a coach that will coach your leadership team and your team on implementing the EOS system and getting that off the ground.
Yeah. I think I'll hire you pro bono to be our implementer.
Well, I don't know if I have the time for that.
That's a joke.
You can certainly try, but it's It's
no, I know it's big
good.
money. It's worth it, and that's what makes you different. This is a very structured meeting. It gives you timelines. You want to open up with some personal stuff, some wins. Get people loose a little bit, and then go into 5 minutes here, 5 minutes here, and then you talk 60 minutes on your idea or your you identify, discuss, and solve IDS. Like, how do you solve a problem? You have to identify a problem. Okay, once you identify a problem, what's next? You discuss the problem as a team, right? You discuss, right? And then there's S, you got to solve it, come to it. And that's where maybe there's a integrator, a visionary. You guys will, break the tie if it's a split between your leadership team. And, these are really, really amazing things that are super inspiring to me, because this is a structure, organized, something that we never had before. And that since you and I are the same type of people with the visionary mindset, we yearn for this because it's not natural for us, right? So this is a beautiful thing when things are structured.
Yeah, I kind of, when I went through it, I kind of remember reading the E-Myth book, and that really talked about the difficulty of an individual, simply put, the difficulty of business owners working on the business rather than working in the business. And I look at EOS and the traction
Michael
book.
Gerber.
Yeah, I look at
Gerber?
that. I don't remember the name, but I look at EOS.
He's the author, Gerber.
I don't remember who exactly it was, but if that's him, then look it up. But I just think that what this has done is really shown how to work on the business rather than be sucked into the business, where you're doing day-to-day stuff, but you're not actually moving the business forward.
Yeah, the E-Myth is another momentous book that was written a long time ago, and people, entrepreneurs, really learned a lot from his workings and his philosophies on business as an entrepreneur. Something that my takeaways from that is that you have the entrepreneur, you have the manager, and you have the technician, right? So we all have a little piece of that, but we need to understand how to grasp on who we are, right? Are we the entrepreneur? Are we the manager? Or are we the technicians? So that's another book, and it goes also into the culture and how important it is to have. I remember like the operations manual. He was so impressed by this hotel he visited, and he said, "How did you know like my favorite water was Fiji? Or how did you know I like 90% cacao chocolate like in the morning with a banana?" Oh, that's part of our list. It's part of our operations. So I know I'm going a little bit far-fetched, but that's how businesses really, the best ones, they have their operations manual. They're super set. They're super structured. If there's any questions, just go into the operations manual. Oh, okay, that's what we do when this happens. What happens when a caregiver calls out? Oh, okay, we do this. And it's a lot of checks and balances, and a lot of when I'm missing the word for it, but it's succession, right? It helps with the succession. So I'm really passionate about these books, this self-improvement book. My mind is always just going to the next thing. Let's talk about Sarah Barker, because that's someone I really appreciate. I love that person, and she's just such a good person and trying to help home care agencies grow. And like all of these things that we're talking about right now, this is what makes us different. the topic is distinction. We happen to be in the same type of orbit, through LinkedIn. I found all these folks through LinkedIn, but it's investing into the business. What are we doing with the money we're creating? We're investing into this education piece because we see a bigger picture. So that's why Ryan's here. That's why I'm here with Ryan, and why he invited me to his podcast. And because we understand, that birds of a feather flock together. I find a big purpose here, not just in my life, but what happens after my life. So hopefully I can bring this place, and create some really good things here. So that stigma, not just wherever the regulations are, not so, we don't have such tough regulations, and here or there, there's still a stigma everywhere. Bad things happen with caregivers because they don't have the guidance, because they don't have the education, or, so basically we're talking about Sarah Barker, and she's an amazing person who helps us and guides us and teaches us on marketing with home care. You worked with Sarah as well?
No, I have not worked with Sarah. I've obviously met her, and she seems like she knows her stuff. I've watched her town halls, but I haven't hired her for any coaching or consulting.
Yeah, we had an amazing academy here in West Palm Beach. There was other home care owners, and we helped set it up at the Elks Lodge. And it's basically like she brings in these subject matter experts. She is the reason that I have this whole mindset of helping through education, connecting the resources with your constituents. And it doesn't have to be somebody who signs up for home care services with, welcome back. We can guide them. And it kind of goes back to your earlier suggestion that, yeah, we can't just raise the cost. Not everybody can just afford these services. But we can be set up with the proper Medicaid attorneys, the proper VA aid and attendance types of folks that can help. There could be some VA benefits. So Sarah's philosophy is connect yourself with some of these resources that are able to help other people. So even the experts on care facilities, do you have an Oasis senior advisors in town? Do you have senior
Yeah, we have
placement
that. We
experts?
have a relationship with somebody else that we use, but we do have Oasis as well in the
Okay.
Boston area.
Yeah, so that's the philosophy, and I think it's just like now it's just the normal for you, because you've been doing this stuff, and a lot of the best companies are doing this, which is connect ourselves with the best attorneys, the best um, durable medical equipment company, and by best, I mean the best service, right? Equipment is equipment. It's not gonna, yeah, but there's ways that you make sure that the companies are answering the phones, answering your questions in a great way, always being there for the customer, giving the best advice based on their budget and preferences. So just offering these services, a durable medical equipment service is very important for a home safety assessment, and to make sure that your family and loved ones are safe upon a discharge. I think it's one of the most important things, to have that stuff ready before the crisis. You spoke about it a little bit. Most people are in crisis when they call us. So we know the drill. Do we have similar philosophies on, we're connecting with the resources, so we can kind of take that worry away from people and say, all right, I get this, but here's what, I'm going to send you an email with a list of 4 or 5 steps that are good suggestions for you, or just kind of give that information to people, without charge, of course.
Yeah, I mean, we certainly, when we do an assessment with somebody or an over the phone assessment, we're asking more than just how many hours you need and when you need to start services. There's usually a lot involved when a family member is calling us up, and they're, like I said before, kind of drinking from the fire hose. They're overwhelmed, and they're trying to juggle a number of balls at one time that are all different shapes and sizes. So it's very difficult to do. And if they're able to lean on us for our knowledge of the industry, and they have issues that they need solved that are outside of the scope of our services, we would definitely, and have in the past, introduce them to some of our partners in the industry so that they can kind of leapfrog the uh, exploration phase of trying to figure out what they need versus just saying, hey, call these folks up. They've done a good job for us in the past and they'll be able to help you out. And that's one thing off the to-do list that can get crossed off a lot more quickly. So we do get that feedback pretty regularly that there's a lot of time and attention put towards not just home care services, but making sure that coming home from the hospital is successful in many different other ways and avenues that they need services in.
Mm-hmm. Yeah, that's good, and I think that's the rarity. I think that we're few and far between, that are building up their resource base and having the good resources to know when these things are going to happen, what's going to happen next, basically, what are your options. So if you have any of these questions, or there's a loved one in the hospital, just call Ryan there in the Massachusetts area. You, of course, can call me. And if you want to know, we know lots of people. It's not just us. We're in Ryan's very involved with different organizations. You're in the NAIPC, which is very, very resourceful. You're connected with different folks all over, just like me. So, you could be anywhere. You can be thinking about moving mom to Pennsylvania. I'm sure that we have somebody in Pennsylvania. There's somebody that already came to mind. So this is really the what makes us different. I think is the investing in the education piece. We need to continue to do that. So my next question is, what was your best day ever as a home care CEO executive, Ryan?
The best day ever as a home care executive, I think. I think the best day ever was when my girlfriend Debbie joined the team and provided her her personality and her experience to men and women. I think she's been outstanding in terms of being customer focused, being client centric. We talked about the resources, and her wealth of experience definitely overshadows mine. And so she knows who to call. She knows the questions to ask. She has a lot of experience in hospice and in skilled nursing. So when families have those types of issues, she can answer them very confidently versus I'm not as confident because I haven't spent time in a nursing home like she has. So I think her experience and getting to work with somebody that I care so much for has been outstanding. And it's been great to have her on board. And when she joined in the middle of COVID, we said, hey, listen, either Minutewomen's going to sink or it's going to swim. Not that we were, going out of business, but we said, hey, we want to be successful together. So let's team up, let's work together and see what we can do. And, it's been great doing that. So I would say that's been the best day so far.
Yeah. Wow. So pushing the chips all in there at that time, hey, we're going all in on this company. And so you found that, that's a brilliant answer. We may make a YouTube short about 40 seconds and send it to your girlfriend.
There we go. She'll love it.
That would be nice. Yeah. No. Okay. So aside from that, you mentioned Debbie, an integral role, a key pivotal employee, synergizing with you. And who else is on your team? I'd like to know kind of behind the scenes, if that's okay.
Yeah. So we have two schedulers that are available. So we're open 7 days a week, 7 to 9, Monday through Monday, basically. We have a recruiter, which is Erica. We have our client care coordinator, which is Caitlin. We have a financial manager, that's Beth. And then we have myself and Debbie leading the team, and we're in the process of finding an operations person.
Good. I mean, that's all I need to hear. That's a strong team, and it makes me happy because that's a lot of times what makes us different is that we have a strong team in the office. We have about 6 or 7 employees as well. And, going over those same types of things, maybe a little bit different, with our compliance stuff. But it's important to have the double scheduler, to have, a backup person there, and to have people that are there, because it takes a team to really capitalize. And I'm sure that those two schedulers, when needed, they can really work together and, find solutions. And, because I see a lot of times that it's a husband and wife couple. The wife is the nurse and the administrator. The husband's the assistant administrator. And, they just kind of run the show together. But then what happens when somebody calls about an invoice that, maybe the hours were accidental, there was a little like type of sand thing that gets in the way of the day-to-day affairs. Throw some sand in the operation. Like, it just takes time, but that stuff's really important for the customers, for the end user, because we need to make sure that service is there and the attention is there. So by having departments, that makes everything much better. And I know that the service is, I'm passionate about service with a degree in hospitality management, and I know the power of a team. So it sounds like you have good stuff going on, and all of the best with that operations person. That's also a very key role. Do you have aspirations for expanding, or are you just happy to be right there in the greater Boston area?
Maybe at some point in time in the future. I'm not sure. We're looking at growing where we're at right now.
Good. Because I certainly am. I love the industry. I mean, it's important for us. If we really are passionate about it, it's important, I think, to spread that around, and to be the people to change that stigma, and just be that night and day. I've heard that night and day metaphor. It's been night and day from one company to the other. And I'm just really grateful, because it's not me. It's my team. It's operations. I'm just the guy ponying around in this, suit, and telling people how happy I am and how good we're doing, and whatever it is, we'd love to help you, and that's what I do regularly. So it's really operations. I understand is the most pivotal, most difficult, and I was there before. It's just not my forte. I love the end game. I love the fulfillment when it works, but it's a lot of hard work. So kudos to your team. And always kudos to my team. I want to give them, I don't even think they've seen maybe 5 minutes of this podcast in general, but that's okay. That's not their department. I'm just going to continue on meeting people and exploring and trying to provide resources for the community. And that's what we're doing here. Well, all the best. And thank you, everybody, for tuning in to the Elder Care Insights podcast. Ryan, I'll see you in Atlanta. And I think this was very informative, and the audience is really going to appreciate listening in and learning all about what you do and what we do. So thank you.
Thank you so much, Lee.